Hello, everyone, and welcome to this presentation. My name is Camille Gagnon. I'm a clinical pharmacist and assistant director of the Canadian Deprescribing Network. I'm here today to give a talk entitled, Do I Still Need This Medication? How to make sure your medications are helping and not harming. Let's dive in. My presentation will be really to talk about two very important themes, which are medication safety, which I'm sure you guessed by the title of the talk, as well as deprescribing, which may be a new word, but bear with me, I will be introducing this term and this concept throughout the talk, so you should feel more comfortable at the end with this term. What is our plan for today? So I've divided the presentation into three big questions. These are the questions we're going to try to answer, and it'll guide us through the talk today. The talk should last about 20 minutes, a bit more perhaps, but should be short and snappy and really get to the point. So firstly, you'll learn, why does aging make us more sensitive to the effects of medications we take? So why are we more sensitive to medications as we grow older? That'll be the first question I will try to answer. The second question I'm going to try to answer is, in what situations would the risks of medications outweigh their benefits? Are you starting to think about situations where you've seen how medications perhaps didn't help a person, or maybe it was even yourself? So we're going to try to identify cases where we could flag the situation. And the last question is really the hands-on, taking action question. So how can you, as a patient, perhaps we're all patients in some ways, caregivers for someone in your that you take care of, and healthcare professionals work together to prevent medication side effects? So how can you, as a person, help reduce harmful medication effects in your community? May it be for you or for others around you. So let's dive in. But first, I do have to flag our conflicts of interest. In fact, the Canadian Deprescribing Network is funded by the Canadian Institutes of Health Research. So we have no conflicts of interest to declare. Now, I always like to start off by saying, when I give this presentation, I did not become a pharmacist to go out and say medications are bad. In fact, medications are good for a variety of reasons. They are needed for health and are one of the main reasons why Canadians today live longer than ever. So medications can help us, and I've regrouped it into two broad categories under point number 2 and point number 3. Point number 2, improving symptoms. By taking medications, we can help improve our quality of life. By reducing pain, by reducing fever and inflammation, we can help our body and relieve symptoms and help us get through the day. For example, by taking something for a headache, taking something for a bad knee. Quality of life is important, and that's how medications can help us on the day-to-day basis. Then medications are good to help us manage what we call chronic conditions. And actually, this third point here is the reason why most people take medications on a day-to-day basis in Canada, actually. And I'm sure you recognize some of the conditions that are listed there, such as diabetes or high blood pressure. There's a great number of Canadians who are affected by these conditions. By taking medications for chronic conditions, we can help control them and prevent complications. That means, if I take diabetes as an example, if we control diabetes correctly with medications, we can perhaps help prevent a stroke, a heart attack, or problems like pain in the feet or hand, so in the extremities of the body, or chronic kidney conditions. So complications that diabetes can cause. So really, in the end, medications can help extend our life expectancy. They provide various benefits to individuals, And so I would like to give this clear warning here that after this presentation, do not stop any medication before talking with a health professional. That is very important. So how many medications are taken by Canadians today? Let's look at older adults, really. So for this presentation, that means 65 years of age and over. So what percentage of older adults, 65 plus, living at home, which is the community dwelling term there, take at least 5 or more different prescription medications? So this statistic will exclude anyone who lives in a long-term care facility, and will also exclude any non-prescription products like vitamins or anything you would buy over the counter at the pharmacy. So I'll let you think about it. What percentage of community dwelling older adults take at least 5 or more different prescription medications? So you have a picture there to kind of give us an idea of what it would look like in a pill pack. So I'll let you think a little bit, and there you go, the stats there. 66%, so 2 individuals out of 3 will take at least 5 or more different prescription medications. How about 10 now? Let's move into a higher number of medications taken. So what percentage of community dwelling older adults take at least 10 prescription medications? 27% is the answer. So 1 out of 4, in fact, will be taking at least 10 prescription medications. My last question here of my short quiz is really to get you thinking about age and the influence of age on the number of medications people take. So the question is, what percentage of people over age 85 take 10 or more medications? What I want you to start thinking about is, as we grow older, so from 65 years of age to 85, do we increase the number of medications we take, or is it reduced? So there are 2 theories, but I'll let you think about it. 2 perspectives. One can expect that, people are older, so they're probably healthier at that point in terms of they've lived past life expectancy and average life expectancy in Canada, or they're older, so they've accumulated more medications. Well, in fact, that would be the right answer. So as we grow older, so 85 versus 65, we take more meds. So with 38% of people that are over age 85 who live at home taking 10 or more meds. That's a lot of numbers. I recognize it. But all I want you to keep in mind is that really that represents a significant amount of medications to be taken on a regular basis for a lot of us here in Canada that are 65 and over, okay? But why are we concerned about it? That'll take me to my first question today. Why does aging make us more sensitive to the effects of medications? Well, I didn't mention it to start off. We take more meds. That's the first point. Then, as we grow older, the benefits and risk of our medications will change because of changes, and that's one of the reasons, changes in our body. Let's just dive in to why that's the case. So here's an image of a body with important organs that are pointed with an arrow towards them. So I will show you the text too, and we'll walk you through why we become more sensitive to medications as we grow older. The first point that I want to explain is that our brain becomes more sensitive to medications as we grow older. That means that when we take a medication that can make us confused, drowsy, losing balance, well, our brain is even more sensitive to the medication. So we're more at risk of suffering from a variety of these effects, like the ones I just mentioned. The second reason why we become more sensitive to medications is that medications tend to stay in our body much longer than in younger individuals. So individuals that are older tend to accumulate the medications in their bodies, because the medications like to accumulate in body fat. And as we grow older, unfortunately, our body fat mass proportion will increase. So the medication tend to linger in our body. And say the medication was supposed to act to have an effect for 8 hours. Well, look at that. Now it's acting for 12. So brain more sensitive to the medications. Reason number 2, medications accumulate and stay much longer than expected. And then last point is, how do we clear the medications? Well, we use our organs, liver and kidneys, right? But as we age, these organs unfortunately do not, they don't process medications as well to eliminate them from our body. And so medications accumulate yet again. So we're not as good as in terms of clearing the meds, and they stay. So all in all, we take more meds when we're older, but also our brain is more sensitive and the medications accumulate. They stay in our body much longer. That can lead and can also lead to higher concentrations of the medications in our body, which means, you know what, that we're at higher risk of having a side effect because of all these changes. There are groups in the population that are more at risk of suffering a side effect. In fact, we know that older adults, because of all the reasons I've just mentioned, are at higher risk of ending up in the hospital because of their medications. In 2016, 1 in 143 older adults were hospitalized due to harmful effects of their medication. That's problematic because these medications were there to help, right? Not to lead the person into the hospital. That's very concerning. So groups of the population that are at risk of harmful effects, yes, include older adults, but also people who have multiple medical conditions, as well as an important portion of the population, if I can call it that way, women. Women are at higher risk of suffering a harmful effect of a medication than men. So keep that in mind, right? We're older, so we're at higher risk of harmful effects of medications, but even within the older adult population, women are even at higher risk than men. Now let's go over our second question. In what situations would the risk of a medication outweigh its benefits? Okay, I don't have an answer that's easy, right? We know that each individual is different and responds to medication and has a different medical profile. However, we know that in a phenomenon that we need to be on the lookout for is called polypharmacy. Okay, I'll call up on your notions of ancient Greek, looking at the word polypharmacy, which is quite long, poly meaning multiple and pharmacy meaning medications, right? So polypharmacy in itself, what does it mean? It means taking a combination of medications that do more harm than good. That's simple as that. How do we know when we are suffering from polypharmacy? Well, that means that the individual in itself isn't benefiting from the medication, but rather the risk of harmful effects is increased. That can mean a variety of things, but here's a list. We're at higher risk with polypharmacy of having a drug interaction, or suffering from falls, fractures, problems with memory, and even hospitalizations, which I showed you a stat just a few slides ago about how many older adults actually are harmed and end up in the hospital because of medication that wasn't necessarily doing good in their case. Apart from having a combination of medications that doesn't help us, we know that there are medications that are in their own nature themselves called risky for older adults. So their potential for risk is higher than their potential for benefit in older adults. That's the first condition that needs to be fulfilled for a risky medication. The second condition is that a safer alternative treatment has to be available for this individual that may be as effective or more effective to treat the condition. So we know that combination of medications, taking too many medications can be risky, but also specific medications can be risky. Let's give you an example of what a risky medication is. But first, I'll want to just flag that a lot of Canadians are taking risky medications. In fact, over age 65, 31% of women take a risky medication, whilst 31% of men, take a risky medication versus 42% of women. So women take more risky medication than men. And as we're older, so 85, the number of risky medications increases yet even more. So about half of women who are age 85 or over take a risky medication. I did say that I would give you an example of a risky medication. Here you are. So sleeping pills is a classic example of what we call a risky med. Why is that? Well, when we look at the benefits of sleeping pills, well, they're not great. They help you sleep on average 14 minutes faster. They will benefit on average 1 person out of 13. So they're not awesome, if I can say that. But we know as well that they increase the risk of very serious harmful effects, such as falling, suffering a fracture, motor vehicle accidents, and having problems with your memory. So all in all, when we go back to the benefits and risks image, we are concerned because the risk here outweigh the benefits. We did say that in terms of side effects, sleeping pills have an impact on a number of ways our brain processes things. So it has an impact on concentration, how we plan, and then our memory. So that can lead to a variety of things like falls and the motor vehicle accidents we've just flagged. So what I want you to take away from this, in terms of the sleeping pill, is that yes, when we look at plus and minuses, well, the risks are higher, but also that there are safer alternatives for sleeping pills. So to treat sleeping problems, we can actually avoid sleeping pills by using what we call non-medication options called cognitive behavioral therapy for insomnia. So that's a very long name, but it's a therapy that we can use that is pill-free and can help you sleep even better than a medication. But we know that if we stop a sleeping pill cold turkey, so one day we just stop taking them, it's the worst thing to do because the next day we have problems with sleep and then we think we need them. So it's like a vicious circle. What we want to do is to really discuss this with a health provider and plan appropriately if we are going to try to reduce and stop the medication over time. So the first question was, why are we more sensitive as older adults to medications? I hope you remember the key points, which were our brain is more sensitive, our body tends to accumulate the medication so it stays longer in the body, and also, well, we take more meds. The second question we looked at was, what is the issue with risky medications? Well, we've looked at the fact that taking a number of medications together, too many medications, as well as taking specific medications can lead to risky situations. But what can you do now as an individual to help members of your community prevent the harmful medication effects in your community? We are putting forward what we call a solution called deprescribing. So it's a long word, but just look at the word in itself, and you can probably guess what it means by splitting it up in two again. Deprescribing is the opposite of prescribing. Deprescribing means reducing or stopping medications that may or may not be beneficial or may be causing harm. What are we trying to do with deprescribing? We want to improve or maintain quality of life, which is super important. Very important as well, deprescribing is always to be done with a team. Your doctor, nurse, pharmacist, health professionals involved in your care. Never alone, because some of the medications you need to plan accordingly in terms of risks of having withdrawal or rebound symptoms. So every time we consider deprescribing, it's done as a team. So if you are taking medications, or you know someone in your family or surroundings that is taking medications, what can you do to prevent medication side effects? Well, book a special appointment. That's the recommendation. Now it's time of COVID. A lot of the medical appointments are happening by phone, but this is not a barrier. You can have this discussion over the phone. So make a special appointment with your doctor, your pharmacist, your nurse, to discuss this and see if you can reduce your medications. By asking the question, you will be more informed. So we have a list of 5 questions that we would like to suggest for you to help guide the discussion with a health professional. So to have a very good, thorough review of your medications, the first question you can ask is, why am I taking this medication? You may be learning new information about the medications you take that way, which we know that when patients are more informed, they will be able to take better decisions for their health. The second question you can ask is, what are the potential benefits? What is the good that I can take out of this medication? And what are the potential harms for this medication? So important question to ask. And so you'll have a better idea of plus and minuses for a treatment that you're on. Can my medication affect my memory or cause me to fall? These are very important side effects that we know matter to a lot of people, because having a fall or having memory problems can lead to a loss of independence. So we want to flag these medications that can cause a problem in that perspective. For the fourth question is really to the point, can I stop or reduce the dose of this medication? Ask these questions to your doctor, nurse, or pharmacist. Maybe the answer is no, but at least you'll have asked and you will know, you'll be better informed. And if the answer is no, well then that's okay. You may be really just starting the discussion over time, and the answer may change in a year or 2 years, but it's great that you've initiated it. And the last point that we want you to discuss is follow-up. So when do you follow up with a health professional, and who do you follow up with? If a medication, for example, will be reduced, so we'll lower the dose, we'll be deprescribing the medication slowly, you'll probably want to have someone following up with you, in some cases, to follow up on your symptoms and how things are going. And if you're putting in place other strategies that are not medications to help treat the condition, it can also be a good way to check in with you. So these 5 questions here, I will show you resources at the end. You can find them all on specific documents we have online. So don't write off all of the questions right away. I'll show you a link and you can find all this information easily. What can you do really to summarize? I've given you 5 questions to ask. And really that is to engage in a discussion with your doctor, your pharmacist, or your nurse. That way you can discuss if deprescribing is an option for you. Really, that will also help you inform yourself about your medications. The last point we want you to help us with is spread the word. Really talk about deprescribing to friends and family, people in your community, to get them to know about this concept, and for them to then engage with health professionals that are involved in their care. So really, to summarize, what we want is for you to ask questions, stay informed, be proactive, and then you'll be better equipped to participate in making informed choices. This was a short presentation on deprescribing, but I'm sure you're curious to learn a lot more. Here is a link for you to discover that exact exactly. We have a number of resources. We have posters. We have brochures on specific medications that are considered risky medications, but also brochures on how to get a good night's sleep without medication. You could all find that at our website. The address is deprescribingnetwork.ca. So you see it just here, deprescribingnetwork.ca. I invite you to check that out. It is all free, and we're just grateful when people use the resources. The brochures we have there, we have a variety of them, as I mentioned. We also have articles on specific topics, articles for caregivers, articles for on specific medication side effects like memory or falls. So go ahead and discover these. We really appreciate when people share them with others as well. If you want to reach out to us, we have a Facebook page, we have a YouTube channel, and a Twitter page as well. So please join us on social media. You want to reach out and share this information through a new webinar or other presentations with members of your community, the email is just there. Reach out to us. We'll be thrilled to hear from you. So I would like to thank you for your time and encourage you to engage with the people around you and help them really talk about deprescribing with their health professionals. That is our ultimate goal, to have meaningful discussions between patients and health professionals to happen around medication. So thank you so much for your time. Bye-bye.